allow me to just do a short introduction. Welcome to Date with Dr. Chong. Today's particular topic will be how does a person develop high cholesterol and how to control or reverse it. Basically, Dr. Chong graduated from Trinity College since 1996. He's a medical practitioner for the past 25 years. He's also an aesthetic physician specializing in anti-aging medicine since 2016. And Dr. Chong also have more than 25 years in family medicine. And for those who are staying in KL or in Malaysia, that you are having some issue when you are taking ASENTAR or when you are listening to a doctor's advice, if you need Dr. Chong's help, you can actually connect with us and then we can arrange a session. You can actually meet Dr. Chong, go down to Dr. Chong's clinic in KL. Actually, it's not an issue. All right, we have a few cases that we actually recommend them to actually meet up if the situation arises, to find out more, to have a second opinion. Okay, with this, Dr. Chong, I'm going to ask you a very simple questions, Dr. Chong. Actually, what are cholesterol?
Hi, everyone. Okay, it's Dr. Chong here, and a very good evening to everybody. Wherever you are, hope you guys are healthy and safe at the moment. Okay, Marcus, thank you for the introduction. Okay, cholesterol is actually a very big topic, okay, and a lot of people actually worried about cholesterol. And from my experience, in my last 25 years experience in my general practice, cholesterol is part of a very major sort of like a problems of patients that I see every day. Okay, a lot of people, they know cholesterol, they're very afraid of cholesterol, and they don't quite really know what is cholesterol and what cholesterol can actually do to their body and what are the harms that are being done. Okay, so tonight I'll be talking about cholesterol. Okay. Cholesterol is actually oil. Basically it's like a waxy fat-like substance that is found in the cells of our bodies actually. And people are worried about cholesterol, but cholesterol is not something that we can do without. We have to have cholesterol. We need cholesterol to live so that our bodies are healthy. The problem starts only when there's too much of cholesterol in our body. We need to have cholesterol, but we can't have too much of cholesterol.
I see. So, Dr. Chong, then what are the causes of high cholesterol actually?
Okay, there are actually a lot of causes of high cholesterol, basically. And the number one factor that, we are actually having high cholesterol now is we are consuming too much of cholesterol. Cholesterol actually come from what we call fats. Fats are basically oil or just basically waxy, oily substances coming from animal products. And these products are what we call all these red meats, dairy products, butter, like the chicken skin. And these are the sources of the cholesterol that we are consuming every day. And if we take too much of it, our cholesterol will go high in the body. Like these are some examples of those things. The red meats. Red meats are all high in cholesterol. And the more of the red meats we're talking about, actually, the higher the levels of the cholesterol. Dairy products is another source of cholesterol-rich food.
Okay.
And sometimes when we eat too much of trans fat, trans fat is basically chemically sort of like a engineered oil that make the oil to be like a solid in the, in the normal temperature. Okay. And this sort of trans fats can actually increase the cholesterol level in our bodies. Things like also eating too much of popcorn, and these are microwave popcorns, and they can actually increase the cholesterol also in our body.
Okay. So, Dr. Chong, what other factors for high cholesterol? What other factors besides those that you mentioned just now?
Okay, yes. Apart from eating too much of cholesterol-rich food, other factors that contribute to high cholesterol in our bodies are the way we live our lives, actually. You see, when we do exercise, when we are active, okay, we are burning the excessive cholesterol in our body. If we do not live an active life, we just trying to be, let's say we are going to be sedentary, we do not do exercises, and this will contribute to our cholesterol being on the high side.
Okay.
And another thing is, obesity, which is now very prominent in, the modern societies, when people are eating too much and they're not exercising enough. Yes, obesity is also associated with high cholesterol.
So what are the signs and symptoms of high cholesterol actually?
Okay. Many of my patients will come to me, asking me, okay, I've got headaches, I've got neck pain, I've got this and that. Okay, is this a sign of high cholesterol? And they're very worried about cholesterol. But I can tell you from my experience over my last 25 years being a doctor, most people with high cholesterol do not feel that they have high cholesterol, or they do not know that they have cholesterol. The only way that someone can know that the cholesterol is high is by checking the blood and measuring the cholesterol in the lab.
Oh, so Dr. Chong, what you are saying is basically when they are having high cholesterol, basically there's no symptom. The only way to check whether they have high cholesterol is only through blood tests.
Yes, that's correct.
Then what happens of those symptoms that actually appear, for example, like blocked arteries?
Exactly. A lot of people, you see, high cholesterol, causes a lot of problems. Okay, one of the major problems are actually blocked arteries. Arteries are everywhere in our body. So when arteries are blocked, okay, let's say the arteries in the heart is blocked, we can get heart disease. When arteries are blocked in the brain, we can get stroke. When arteries are blocked in the kidneys, we can get kidney failures, kidney problems. And when arteries are blocked in our fingers, our legs, our hands, then we can get, numbness, whatever. So all the symptoms we are talking about now actually are not directly because of high cholesterol, but because of the problems caused by cholesterol. Things like, okay, when you have blocked arteries, you get heart problems, you get chest pain, you get shortness of breath, get like pain in the neck and jaw because of your, of your heart problems. And severely high cholesterol can make you feel very fatigued because there's reduced blood circulation to your body. And sometimes it can even cause nausea, when the cholesterol is very high. Normally when it's coupled with high cholesterol and high sugar, tummy pain is another problem. If arteries in your abdomen is actually blocked up and you have reduced blood flow to the, to the arteries and blood vessels in your tummy. Numbness is another, what they call that, a common numbness of the hands, numbness of the back, because, when cholesterol is high, the arteries are blocked, the blood vessels are blocked, you get reduced blood supply, so you can get numbness, as a result. And another thing is cold extremities. Extremities means your fingers, your toes. These are the places, away from your heart. When the blood circulation is too low or too reduced, yes, you can feel this off like cold extremities as well.
So, Dr. Chong, does free radicals in the body make the high cholesterol condition even worse, actually?
Yes. Actually, when we talk about, all this while, people correlate cholesterol and, blocked arteries and heart diseases and strokes and things like that. Yes, this is an undeniable fact. Cholesterol will actually block the arteries and will actually end you up with heart problems, heart attacks and strokes, okay? But there's one thing which is very important is what we call free radicals.
Okay, so Dr. Chong, then what are free radicals actually?
Okay, to talk about free radicals, we need to go back, to the anatomy of our body here, okay? Does everybody see the slide on the screen?
Yes.
Okay.
Yeah, okay.
We have one. Okay, our body is made up of different systems, okay? And these different systems are made up of different organs. And when we break this thing down to, to a more microscopic sort of like anatomy, it goes to tissues. And tissues are basically made up of cells. And in every single cell, they are made up of molecules. And the most basic molecules are made up of atoms. We need to know what are atoms to know what are free radicals. Okay, so in the picture on the screen there is a very stable and healthy atom. Okay, atom is made up of a nucleus, which is the center part of the atom. And this nucleus is made up of neutron and proton. Okay, and around this nucleus, there are what we call circulating electrons. And these electrons are actually in pairs and they actually occur in even numbers for this atom to be healthy and stable.
Okay.
So what are free radicals? So free radicals are formed when these electrons around the nucleus are not actually occurring in pairs, actually in odd numbers. And these odd numbers will make them becoming free radicals.
Okay. Understand.
Basically, free radicals are atoms, which are not stable because they are not having their fullness, the electrons are being taken away or being added on, so they are not in their healthy state. They are free radicals.
Okay, so what are the causes basically substance that generate radicals?
There are two actually main sources of free radicals. Classify them as an internal and external cause of free radicals. Internal free radicals are those things that we produce in our own body every day. During the metabolism of our cells, we need our cells to go through metabolism, go through chemical reactions to produce energy. And during this energy production in the cells, we actually produce free radicals. Okay, this is our internal free radicals. External free radicals are those things that, like beyond our control. They're from the external factors like sun rays, ultraviolet, like rays from sunlight, pollutions, too much of fried foods, cigarette smokings, and these are all, like factory pollutions, chemicals, in the water, in the air that we breathe. This can produce free radicals, which can damage our bodies.
Okay, so Dr. Chong, what you are saying is the free radical comes from two areas. One area is external factor, which is found in the food we eat, the medicine we are taking, the water that we breathe in, pollutions and all that kind of stuff, smoking and alcohol. So another version, another aspect of free radical is actually the metabolism process in our human body that created that actually.
Yes, that's correct.
Okay, so based on the evidence that you are mentioning just now, so what it means is the evidence is actually accumulating because of the free radical. That's why we have a lot of problem based on this particular slide, correct?
Exactly. You see, after all the studies that we have been going through all these years, you know why our body ache. As we get older, our joints will start degenerating, our hair will start falling, our skin will become more wrinkled, and our heart will start to fail, our kidneys will start to fail, and this because of free radical damages. So free radicals damages are actually what we call an aging factor, an aging process. Okay?
I see.
So the more free radicals in our body, the worse our aging problems, and the more we have this what we call degenerative diseases like joints problems, arthritis, asthma, diabetes. Diabetes because of our pancreas failing, and dementia when our brain cells are degenerating and dying. We get dementia. We get like eye problems, like people, as they get older because of all these, like free radical damages throughout the years, their eyesight will actually reduce as a result. Okay, all these are what we call degenerative diseases, and these are what we call, like diseases caused by free radicals or too much of the free radical. And the more you get it, the faster you get these diseases.
I see. So, Dr. Chong, based on what you are saying, please allow me to do an illustration to picturize what you are mentioning just now. Okay, I'm going to do an illustration here. Correct me if I'm wrong along the way to see whether I am seeing the picture what you are showing. First of all, what you are mentioning here is actually all human formed by cells, and our cells actually form the tissue in our body, and from the tissue it actually forms the organs, and organs actually forms our system. And then put all the system together, it forms our human body. Correct? Yes. Okay. So
yes.
when the doctors say,
right.
when we go for a medical checkup or something, when we go for diagnosis, when the doctors say, oh my God, something is wrong here, what they actually meant, if you trace back based on this chart, means the system something wrong, the organ something wrong, there are something wrong with the tissue, and then back to the roots of the problem, the cells actually fundamentally at the core, something is not right already. Is that right?
Yes, that's correct.
That's correct. So based on this factor, it means the roots of the whole problem is actually on the cells. So if let's say, Dr. Chong, if you want to solve the roots of the problem, because Western medicine help us to do damage control on the body, but at the root cause where the cells are, we need to do something about it because of the free radical. Am I right to say so far?
Basically, because if you do not have healthy cells, you cannot form healthy organs, you cannot actually build healthy organs and systems, and you cannot build a healthy body if you do not have healthy cells.
Okay, so if that is the case, then we need to solve the cells, then we break down further based on my understanding. Okay, from cells, if we break down further, we form molecules. For molecules, when we break it down further, we will see atoms, like what you mentioned just now. And atoms, when we break it down, we will actually see protons, neutrons, and electrons based on the structure just now. So that means it will actually appear like this. So this is what we call a very stable atoms, where we have 4 sets of electrons. However, based on 2 factors, 1, the internal metabolism process that created oxidation. 2, the external factor because of the sun, the food we eat, the radiation and all the stuff. When 1 electron go missing, then this entire thing becomes unpaired and unstable, is the reason why it is being called a free radical. Correct or not?
Yes, that's very true.
Okay, so having said this, what is more scary is the action of the free radical, like what you mentioned just now, is once they are unpaired and unstable, they will go to the next door and start snatching other people's electrons to become own electrons. So it's as good as like taking other people's men become own husband,
So
other
become more
people's
stable.
more stable to become more stable. So they are snatching other people's woman become own wife and snatching other people's men become own
Yes.
husband. Okay, so effectively free radical is what we call the third party, right? 小三
Yeah, basically third party is causing a lot of like damages, a lot of messy damages in
I
the
see.
cells and things like that. And this will actually result in a lot of what we call the, like a cellular damage. When cellular damages are there, our organs will start to fail, and then we'll see all the occurrence and the, the upcoming of what I just mentioned, the degenerative diseases.
Okay, now I understand. So when that happens, they start snatching already. Means the next one will go and snatch the next one. So basically, what they will happen is they will continue to keep
It's a chain
snatching.
reaction. Yeah.
It's a chain reaction to the next one actually. Okay.
Yes.
So, okay.
Yes.
So if that is the case, there is no ending to it. Why? Because what will happen after 30 to 40 years when trillions and trillions of cells in our body being attacked by free radical? Does it mean this is the case?
You just get more and more damaged, and the
Okay.
more free radicals you have in your body, the faster your age. That's the reason why when people, smokers, when they smoke, smoking is actually a very, very major, like activity in producing free radicals, So people who smoke, they tend to have like lungs problems, they tend to have a lot of like smoking related diseases, they age much faster. A smoker will look much, like an older, like of another person of the same age because of the smoking effect itself, of the free radicals damage itself. Okay, so you find some of the free radical damages that we normally see, as I said earlier on, ultraviolet rays from sunlight, it actually produces a lot of free radicals, and these free radicals can cause, when these free radicals are attacking the skin, the cells of the skin, that will cause a lot of aging process of the skin, a lot of wrinkles, pigmentation formations, these are the things that can happen on the skin. Like when free radicals are attacking the proteins, proteins are actually present in every single cell of bodies. Actually, when proteins are being attacked by free radicals, they go into like what we call like malformation, becoming denatured. That means these proteins are not doing the jobs they are supposed to do. So that will affect our organ function. Another major thing, why we are getting cancers. When DNA are being damaged by free radicals, we get mutated cells. Cells are not actually like being sort of like made in the normal way. And these cells, which are abnormal, can actually cause cancer formation. Come to the topic tonight, cholesterol actually. Cholesterol itself, yes, the higher the cholesterol you have in the body, the higher the chances of you getting the blocked arteries and the heart problems, the strokes and the kidney damages, that sort of things, okay? But what causes the cholesterol to be so harmful? Yes, cholesterol actually causes the blockages, but when there are a lot of free radicals, the free radicals will make the cholesterol even more dangerous, what we call the hydrolyzed cholesterols. And these hydrolyzed cholesterols are actually very, very dangerous to our blood vessels, and they will cause much more sort of what we call like a blockages of our arteries. Like, let's say a person, with a cholesterol of like, let's say 3.6, compared to a person with a cholesterol of 3.6 or so, this person doesn't smoke. The second person actually smokes, okay? Even though both of them are actually having the same level of cholesterol, the person who smokes, the person who's having a lot of free radicals are much more likely to get what we call the blood vessel damages, and that leads to what we call heart diseases, strokes and things like that, and cancer formation.
So, Dr. Chong, what you are saying here is...
Am I making myself clear? Actually?
Yes, okay. Dr. Chong, so can I just repeat what you are just saying, just to have an understanding for us? Okay, so what you are saying is, having cholesterol is definitely in our system. However, because having a cholesterol of 3.6 non-smoker and 3.6 smoker, so whatever the chemical derived from the smoking actually so-called speed up the cholesterol. It's like a catalyst to make the entire cholesterol harden. That creates atherosclerosis, that means the hardening of the blood vessels and blockages. Is that what you're trying to say? That means the free radical coming from smoking, or they actually speed up, it's like a catalyst to harden all the blood vessels.
That's very correct. That's why you see some people have, there's a reason why sometimes, like let's say maybe somebody in a family, the cholesterol is high, but they're quite, they're quite healthy. They live, like till the age of 80 or whatever, without any major problems. They don't get major, like cholesterol related problems, even though their cholesterol is high, because they don't smoke, they live a healthy lifestyle. Okay, compared to somebody, who has high cholesterol, but not as high as the one before, but he smokes, he drinks, he goes under the sun all the time. He doesn't live a good life. He doesn't exercise, the weight goes up, whatever. And even though his cholesterol is not as high as the other person, but he actually dies from heart attack, at the age of maybe 45. And this is the reason, what we call free radical damages that speeds up our cholesterol-related problems.
I see. Okay, Dr. Chong, I have one myth and one saying that I constantly hear from people who smoke. They always tell us that they have friends who doesn't smoke but die faster than them and have a stroke faster than them. What was the real reason behind all this actually? Does it mean that because they usually point out the fact that they smoke and they are okay, but those friends that don't smoke actually, based on medical, even though so, but actually they die faster. They have a stroke, they fall down, and versus them who are smoking. So to them, they feel that smoking doesn't really cause the situation scientifically or medically. But based on your understanding, what was the reason why the person who don't smoke actually sometimes do die faster? Is it because of purely smoking or because of something else?
Okay. Cholesterol is just like how they say, when it comes to aging process, when it comes to different diseases formations or the pathogenesis, why certain diseases, certain cancers or certain problems actually start in our body, it doesn't only depend on one thing, okay? And it doesn't die of something just because of the cholesterol being high. There are other reasons, even though that person's cholesterol is not high, but maybe other reasons, the person is suffering from diabetes, the pressure is high, the person actually or genetically born, to be having higher chances of cancers. So they do die faster. Doesn't mean that, okay, just because my cholesterol is high and your cholesterol is lower than mine and you die faster, so my cholesterol is not the problem. It doesn't, it doesn't.
Okay.
Sometimes you just have to mix all of the factors together to actually finalize and to try to come to a conclusion or to try to come to a reason why somebody has developed something. There's no one thing that causes everything.
I see. So basically,
but I can tell you, free radicals are actually is a very, very, from a lot of scientific studies and papers that's been published, free radicals are actually causing a lot of problems that we guys or we human beings are actually facing nowadays. Okay, people in the last, say back in 30 years ago or in 60 years ago, they don't get this sort of pollution related things. They do not get radiation. They do not get polluted water. They don't breathe in the polluted air. They do not actually consume contaminated, food sources and things like that actually. That's why they actually became healthier. And nowadays, we're actually having a lot of these sort of free radicals damages. A lot of free radicals being around us. Actually, it's beyond our control sometimes, It's not that you can't say that I just do not want the free radicals to be with me. But you're living, in an environment, industries around you. They actually filled with polluted chemicals. People using handphones, a lot of radiation from the handphones, And these are the things that will speed up our aging process or disease generation because of the free radicals they're producing.
So what you are saying is basically if we don't do anything about it, Dr. Chong, it means free radical will be constantly created within us as well as outside of us, created within our own body. So as long as we don't do anything about it, the free radical will become the catalyst for literally many, many, many other diseases, correct?
Exactly. That is one of the major factors in the aging process that we are actually facing nowadays, and in the new sort of what we call, those things I just mentioned, the degenerative diseases nowadays. You see people actually getting, this sort of degenerative diseases much earlier. People get eye problems, when they're 30, but in the last 50 years, people only get it when they're in their 80s, People don't get stroke. The last time people didn't get stroke when they are, in their 40s or 50s. But now people actually getting stroke. They're getting a heart attack. They actually get cancers, when they're 35. They die from a heart attack when they're 40. A lot of these things, can be actually attributed to what we call the free radicals damages.
I see. Okay. So having said this, so Dr. Chong, how to solve this free radical damage using natural antioxidant? The reason why I ask this question is because basically based on the ASENTAR's red ingredient clinical studies on Astaxanthin, would you agree that Astaxanthin's antioxidant level is at this point the highest compared to other cell food?
Okay, yes. Marcus, let me talk a little bit about antioxidants, okay?
Okay, yes.
What antioxidants are, they are supposed to stop or to neutralize or to sort of negate the free radicals in the bodies, actually, okay? It's just how I mentioned that, our bodies actually produce a lot of free radicals, our cells, during the cell production, during our living, our metabolism, whatever, we actually produce a lot of free radicals, okay? And God is great. Our bodies actually produce what we call an antioxidant sort of a system to combat this sort of free radicals produced to our bodies, okay? But the problem starts when there are too much of free radicals that is beyond our body's ability, our own system to combat or to handle. This is a time we need to have an external source of antioxidants to try to stop the free radicals around us, actually, okay? And the more free radicals you are being exposed to, the more antioxidants you need to. And this is what we call the external source of antioxidants. Astaxanthin, so far, is one of the most potent antioxidants available or being studied, actually. So I would say definitely, that if you take astaxanthin, you can get a very good effect in the free radicals in the body.
Okay. So based on this particular one, so when clinically on astaxanthin, when we do a Google, at this point in time, astaxanthin is actually the king of all natural antioxidant. Having said that, because the ORAC value is actually 2.8 to 2.200, it's literally 2.8 million plus in terms of antioxidant level. So at this point in time, based on clinical study, based on research and all that, is astaxanthin at this point in time the most powerful at the highest level when it comes to antioxidant?
Oh, yes. It is a very powerful, antioxidant, and there are a lot of studies that were done, to compare the antioxidant effect of astaxanthin compared to other antioxidants. There are so many other antioxidants, like you can see on the slide. Okay, vitamin C, resveratrol is actually found in grapes, in red wine. CoQ10, okay, green tea, catechins, basically they are just substances found in green tea, vitamin E, other things like what we call that like alpha lipoic acid. But if you look at the studies, that were actually being carried out and being sort of done, they found that astaxanthin, when they compare the antioxidant effect of astaxanthin to these other antioxidants, you can see astaxanthin is 6,000 times more potent in antioxidant property compared to vitamin C, and compared to red wine, 3,000 times, 100 times more than CoQ10, and 560 times more than the green tea, things like that. So I would say, if I were to take an antioxidant, if anyone was to take an antioxidant, astaxanthin should be a very good choice for them.
I see. So having said this, that means with this natural antioxidant with astaxanthin that's present in ASENTAR with clinical studies, so to be exact, how do we really reverse the damages caused by free radicals?
The more antioxidants you take, the higher the doses of the antioxidant you take, yes, that will actually reduce the free radicals that are actually around your bodies or being generated in the body. But of course, just by taking these external antioxidants is not enough. Things like when one wants to be healthy, you do not just rely on the tablet. Let's say somebody is having a headache. You don't just take Panadols every day. You try to find out what is the reason for your headache. Things like, like cholesterol problems or free radical problems. Yes, try to live a healthier lifestyle, okay? Reduce stress in your life, sleep more, rest better, change your diet, to reduce the cholesterol, okay, eliminate trans fat, eating food richer in omega-3 fatty acids, okay, and take more fibers, Sorry, here it says increase soluble fibers, actually both soluble and insoluble fibers. Basically, what I'm talking about here, to try to reverse these free radical damages, you need to actually lead a healthy lifestyle. That is the most important thing, okay? But sometimes, as I mentioned earlier, when you do live through your healthy lifestyle, very healthy, you don't smoke, okay, you don't eat a lot of fat, you sleep well, you do exercise, everything, but you still get a lot of free radical damages. Why? There are a lot of things, because there are a lot of things that is beyond our control, okay? What happens if you live next to a radiation plant, industry? What happens if you're living under some radiation cables, What happens if everybody around you smoke? You're still getting the free radicals. It's beyond your control. It's not that just increasing or just living healthily. You just have to sort of balance out, you see, because there are a lot of things that is beyond our control. You just have to do something about it to try to combat the free radicals.
I see. So basically, what I'm hearing is, Dr. Chong, in order to fight with this condition of free radical being produced, external and internal, besides the healthy lifestyle, the change in diet, and of course, at the same time, it is good to consume a lot of food that contains natural antioxidant or take astaxanthin to help the body system to fight the free radical conditions. So basically, having said this, at the end of the day, due to the fact that there's a lot of factors we cannot control within ourselves. So the only way is at all times, we must be able to do a lot of things simultaneously. Leading a very healthy lifestyle will become the fundamental basics besides our diet and taking supplements like ASENTAR, correct?
That's very true, actually. And I always believe in that, actually, because things are just, how do you say, like, basically, things are just beyond our control. We are not living in a 100% healthy environment. Things are just beyond our control. So we just need something from the external part to help our body to become healthier.
Okay, so Dr. Chong, please allow me to do an illustration again so we can actually help everybody to picturize what we are mentioning just now. So basically, based on what we see just now, the free radical condition because of a third party and situation. So when we start taking food with antioxidant or we take antioxidant supplements, for example, astaxanthin, that is actually the king of what we call antioxidant. Once we consume that, it is able to have all the free electrons replaced in the missing electrons of the free radical to stabilize the entire atoms. Correct or not?
Yes.
Okay.
To make the free radicals less damaging.
Less damaging. So once they are stable again, means the whole atom becomes stable. And from there, it goes up, the molecules become stable. Cells become stable, tissues stable, organs stable. System becomes more stable and the body becomes stable. That means it's from the inside out right to the roots where the electrons is.
Yes. Basically, this is what we are talking about, tackling at the root of the problem.
I see. Okay. So having said this, based on what you mentioned just now also, so the whole system, once it's stabilized, they can literally focus on doing, first remove whatever that is not supposed to be in the body, step by step, remove it out from the body, correct?
Yep.
And then they will start to re-strengthen whatever that's being weakened in the body system.
Yes.
Once the system is able to do that, they is able to remove whatever that's not supposed to be there. They are able to re-strengthen whatever that was being weakened.
Yeah, I was talking about this, to try to live healthily, to eat and whatever, to live our lives as healthily. Then if you can't do it, we really need something external or from the outside, or what we call exogenous, to try help our body to achieve that state.
I see. So re-strengthening.
And once, exactly, once our cells are healthy, once our cells are being sort of like a strengthened, rejuvenated, okay, we can really see the result because cells are healthier, organs are better. When organs are better, our systems are better. And when systems are better, everything is functioning well, our body becomes healthier.
Okay. Once we are able to do that, we can start to do, when you say healthier, means the process of repairing whatever that's damaged also will take place, correct? And then from there, they will, and then from there, they will start to re-defense from further free radical damages. This is the whole process of what the system will run, correct?
Yeah, as you just mentioned, very good that you mentioned this thing about repairing. Our cells are very good, in not just doing the normal, our daily functions, like producing energy, make our hair grow, make our skin, replace our skin, whatever like that. Our cells are very good in repairing. And this reparation, this sort of a repair needs what we call good proteins or good chemicals and good ingredients. And free radicals actually damage them. Okay, so when free radicals are there, they will cause our cells to be less able to repair. So our cells will actually die faster because it can't repair itself, So our organ will fail faster. Our cancers will actually occur in an earlier stage. Our hair will start falling, can't repair our hair follicles. People, last time only start having hair falling at the age of 80, but now we are actually having our hair falling at the age of 35.
I see. So, Dr. Chong, based on what you are saying, based on the remove, re-strengthen, repair, re-defense, once the free radical situation is done, these are the things that we'll be doing in the system. However, you also mentioned just now that throughout this whole process, the cells actually needs two things that will run properly. That means the nutrients for the cells and the energy for the cells to be able to perform all the remove, re-strengthen, repair, and re-defense properly. Correct, based on what you are mentioning just now.
Yes, the food of the cells are important also. When a cell needs to be healthy, okay, the cell needs two things. Number one, it needs some energy source. It needs some good food source. It needs a very good, complete ingredient for the cell to grow healthily. And second thing is, it needs to reduce the damage being done on it. So, so for a cell to be healthy, it needs to grow better, it needs the nutrients to grow better, and it needs to have less damaging things like free radicals.
I see. So by having these two parts taken care of, the antioxidant with astaxanthin able to stabilize and reduce the free radical condition, it allows the system to start to function properly. At the same time, by putting in right nutrients and energy, the cells to perform properly. So basically, what we have done, as long as we provide these two sources, the human system is able to run on top of whatever Western medicine they are taking to do damage control. Correct? It's supposed to be hand in hand. It works hand in hand in that sense.
This is at least the best we can do to our body.
I see. Okay. Yeah. Thank you, Dr. Chong. With this, we are moving into the next session called the Q&A, questions and answer. I'm going to stop sharing so that we can go on to the Q&A side. All right, Dr. Chong, you are on now, everyone. Dr. Chong is back. We would like to see who wants to have any questions. Please feel free to raise your hand so that we can see, and then you can ask questions. We go one by one. If you can type on the chat group so that I can actually facilitate. Yeah, correct. Catherine, is it? Yeah, Catherine, what do you mean by drop hair at 35? You were stunned when you heard doctor say that drop hair at 35. Yes, drop hair at 35 because of free radical attack. True. Yes, correct. Okay. Okay. How about low cholesterol? Okay, we have one question, Dr. Chong. How about low cholesterol?
What's the question about low cholesterol?
Yeah. Joanne, what do you mean by how about low cholesterol? Would you mind elaborate a little bit?
Yeah, actually, like normally when we go for a medical checkup, like normal people, they will show on high cholesterol. But like my LDL, right, will be lower. So would that be considered? That's what people say high cholesterol, but my one is low, and my high side is average, but my low one are low. So would that be considered as a high cholesterol? Or?
Okay, I'll talk about cholesterol. Actually, there are different types of cholesterol. The two main things that when we look at cholesterol, we don't look at the total cholesterol level. Okay, we look at the good cholesterol and the bad cholesterol. Okay, and we want our good cholesterol to be as high as possible, our low cholesterol to be as low, as possible. But as I mentioned earlier on, we all need cholesterol to live. Our bodies cannot live without cholesterol. But we need only very little, little bit of cholesterol. As you just mentioned, your cholesterol level is low. That means your genetic makeup, your body is actually doing the right thing. Okay, it's not storing too much of cholesterol, or because of you not consuming too much of cholesterol. Okay. Cholesterol being on the low side is not a problem, okay? Unless your cholesterol is low and you're taking a cholesterol lowering drug, that causes your cholesterol to be extra low, that is not good actually, okay? So cholesterol should not be high, but yes, we need cholesterol, like being on the low side is fine, but not too low. So you actually, like Joanne, actually, when you say that your cholesterol is on the low side, the LDL, it's a very good thing actually.
But,
okay.
Doctors normally will, after review my medical checkup, they will ask me to go for more intensive, not say intensive, more cardio exercise and cut down on seafood. So these are things that he advised on. Or I have to take
fish oil.
Yeah, the doctors. That's what the doctors advise for me when my LDL are low.
Yeah. No, actually, what HDL? Maybe you're talking about HDL. LDL is a bad cholesterol. HDL is a good cholesterol. Good cholesterol, HDL we want it to be high, and the way we can bring it up by doing exercise, But if your LDL is low, I do not think any doctor will ask you to go on diet control and reduce and do more exercise, because if your LDL is low, it's already good enough.
He mentioned to me before is like my bad cholesterol are high.
This LDL is high. It's not LDL low.
Yeah, LDL is high. Yeah.
Okay, yes, when LDL is high, yes, you go on exercising and you go on diet control, like just reduce, as I say earlier on, cholesterol comes from the food source are actually animal products like seafood, red meat, chicken skin, these are the things, and certain tropical fruits like coconuts, has got a little bit of cholesterol as well. And these are what we call LDL. They are bad cholesterol. If your LDL, your bad cholesterol is high, you need to actually reduce the consumption of those foods. And of course, you need to exercise to burn off the bad cholesterol. And the good thing about exercise is, it doesn't only bring down the bad cholesterol, it brings up your good cholesterol. Okay, we want our good cholesterol to be as high as possible and our bad cholesterol to be low. Okay, so exercise actually does both things. It's got what we call a dual advantage. It brings up your good, it brings down your bad one. Okay, so exercise is actually better than anything else. Okay, so everybody should be exercising, to bring down the bad cholesterol and bring up the good cholesterol by controlling your diet. Just by eating less meat, eating less fats. Okay, we just bring down the bad cholesterol, but it will never bring up the good cholesterol. We want the good cholesterol to be high, so we do exercise. So exercise brings up the good cholesterol, it brings down the bad cholesterol.
I see. So, Dr. Chong, okay, you might interfere a little bit. So, based on what Joanne is saying, the fact that just now you mentioned is sometimes the one that is causing the body harmful is not exactly the low cholesterol or the high cholesterol. If you can exercise, fine. But what is actually more scary is the drug that's being used to do the adjustment. That one will, in the long run, harmful to the body. Is that right?
Exactly. Okay. If someone can do something naturally to combat the problem in the body, to make your cholesterol less harmful, why should you go on medications? Okay, because sometimes when you take medicine, you got a lot of side effects. Cholesterol lowering drugs have a lot of side effects. A lot of studies are being done now. People are talking about like maybe some brain damages or people getting dementia early on. But of course, I say these sort of things are not confirmed yet. But a lot of questions are being raised about this sort of cholesterol lowering drugs actually. But if you can do it the natural way, you take some antioxidants, okay? You do correct your lifestyles. You eat more healthily. You do your regular exercises so that your cholesterol can be kept at a good level. Why should you go on drugs? If I can do without drugs, why should I, go on drugs? I will try the natural way, to control the cholesterol in my body.
Okay. So, Joanne, does that answer your question, Joanne?
Yes.
So Joanne must go exercise, go yoga every week, must go 3-4 times yoga and then do some exercise, Joanne. If not, your husband very worried. Yeah.
Marcus, not just yoga, okay? Exercise needs to be cardiovascular, okay?
Yes.
Cardiovascular.
Say more more for cardio, for heart, like go for jogging or treadmill.
Yeah.
That's what
Yoga is very good. Yoga is actually very good. Yoga is good for sort of like realigning your bodies, posture correction, okay, and stretching your muscles at the joints, okay. And yoga is very good, but on top of yoga, we all should go on what we call cardiovascular exercises actually. And what is cardiovascular exercise? Okay, cardio, needs to be done, regularly, okay. And for us to consider the exercise to be cardiovascular, okay, there must be three things. Number one, okay, you must actually have panting, like shortness of breath during the exercise. Number two, your heart rate must go up. Number three, and you must start sweating. So you have to have these three things, that happen together. And it needs to be continued for 30 minutes at least 5 times a week. And this is what we call cardiovascular exercise. Only by doing that, okay, you can get the benefit of cardiovascular. It doesn't only bring down your cholesterol, it brings down your sugar, it brings down your blood pressure as well.
Okay.
Of course, yoga, is good.
Okay. Dr. Chong, that means what you are saying, Joanne is asking Tabata. That means Tabata is actually some of the training. So Tabata, Tabata training 5 times a week. So Dr. Chong, what you are saying is, besides eating healthy, they must do at least a form of running, cardiovascular, Tabata exercises, at least 5 days in a week.
Yeah, 5 days a week. People used to say okay, maybe every other day, 3 times a week is good enough. But now the American Heart Association recommendation is 5 times a week. And each time it has to be at least 30 minutes.
At least 30 minutes? I see. Okay.
Each time, at least. It can be 40 minutes, it can be an hour, but it has to be at least 30 minutes, doing the cardio for the benefits of it to be, to be sort of like, to be there. Okay, if you just run for 5 minutes a day, okay, yes, it's better than not running, but you don't really get the benefit of doing the cardio. As I say, cardio brings out three things. 我们华人所讲的三高啊, the three highs. What are the three highs? Cholesterol, pressure, and sugar. And exercise brings out these three things.
Okay, so now we have the next question. How about walking? Can walking literally consider cardiovascular?
Yes, as I said earlier on, yes, you need to walk, at a certain pace.
Okay.
At least a brisk walk, so that you start sweating, your heart rate goes up, and then you start a little bit of like having deep breathing,
Okay.
For at least half an hour.
Okay, because
you need to more for brisk walking. Probably you need to continue for 40 minutes, an hour or so.
Okay, we have someone mentioned, some study mentioned exercise will increase free radical. Is it true?
Oh yes, if it's done too much.
How do we gauge whether is it too much or not, Dr. Chong?
It's $1 million question. Nobody knows how to answer that question actually, But if you exercise, at the end of the exercise, the next day you're suffering from joint pain, okay, you are suffering from too much of muscle aches, okay, that is actually what we call over-exercising.
Okay, so
exercise, you should not be feeling bad after the exercise. You should be feeling good after the exercise. Actually, if somebody goes for let's say a Tabata every day for 40 minutes, and then he or she suffers from joint pains, muscle aches, and things like that. That is what we call over-exercising. But there's no one thing that says, okay, what is over-exercising? There's no measurement for that actually.
Okay,
you need to feel good after exercise.
Okay, based on the clinical study, actually for those because I see Jay was saying no pain, no gain. Oh my God. Okay, so no pain, no gain. So basically, if let's say we are going to do exercising, however, I think sometimes after exercise, the body system, the muscle may not be recovery enough. So based on the clinical studies on our ASENTAR Astaxanthin, it stated muscle performance that actually helps the body to recover faster from all these exercises. So does that mean when you exercise because of free radical, you're putting in antioxidant? It's actually able to replace those missing electrons and then remove the free radical condition to allow the healing faster and recover faster? Does that
yeah, that is quite true actually, Marcus. You see, just now I mentioned about our own metabolism, our own body sort of doing our energy production and things like that. Our bodies actually need a lot of energy, for us to do exercise, for us to do things like, staying up at night, not sleeping, that sort of things, So when we do that, we actually produce a lot of free radicals actually, But if you are someone, that really, really go for excessive exercising, or you really, really, do a lot of cardiovascular things, at a regular routine, I would definitely, you go on something like Astaxanthin, antioxidants, so that if there's any excess of free radicals being produced during the exercises, there at least something there to protect yourself, to sort of neutralize the what we call the free radicals, so that the reparation, the cell repair, and then the cell damage, being reduced as a result.
I see. Okay.
You're quite right, actually.
Okay, thank you, Dr. Chong. Now I have two questions here. This is from Irene, actually, Irene Low. So she's asking if LDL is 4.1, HDL is 1.6, both are considered high. So what should she do actually?
So what is the LDL again, sorry?
LDL is 4.1.
The HDL?
HDL is 1.6.
1.6 plus 4.1, 5.7. So 5.7 divided by 1.1, right? The HDL.
HDL is 1.6.
Oh, 1.6, sorry, yeah.
Yeah.
Okay. It's okay, actually.
Oh, it's okay. So
because the HDL, HDL is a good cholesterol, as I say. Good cholesterol, we want it to be high, okay? Bad cholesterol, we want it to be low. So the LDL is a bad one. HDL is a good one. It's very easy to remember. H high, that's what we want. High is a good cholesterol. L is low. We want this is a bad cholesterol. We want it to be low. So HDL is good. LDL is bad actually. So if you have your HDL 1.6 and then your LDL 4 point something, okay, your totals is about 5 point something. If you divide, by your HDL, the ratio is normal. So it's a good thing because your HDL is very good. Anything above 1 is actually considered good. If your HDL is above 1.03, it's already considered as a good level.
Okay, good. So next one, I have one Mr. Michael Chong. He's asking, heart attack can consume ASENTAR or not, in your opinion, actually? If let's say this person had a heart attack before, can they consume ASENTAR?
By all means, please do.
Okay, good. So, Michael, by all means, please do, because we provide the source. The body is the one that do all the healing and recovery, actually.
Yes.
Okay.
For heart attacks, actually, just give me 1 minute to sort of to talk about this heart attack thing. Okay. I will just put it heart attacks and strokes together. This is what we call cardiovascular diseases. Heart attacks block arteries in the heart, and strokes are blocked arteries, in the brain, that causes stroke, actually, Why are we worried about cholesterol? Why are we worried about hyperpressure? Okay. 5 factors, just remember 5 factors, that can actually cause us to get these heart attacks and strokes. Number 1 is cholesterol. Number 2 is hyperpressure. Number 3 is diabetes. Number 4 is smoking. Number 5 is genetic factors. Actually, genetic factor, we can't do anything about it. Okay, so let's say your mom has got heart attack, your dad has had heart attack, both your grandparents had heart attack. Your chances are that you're going to have a heart attack later. Okay, and this we cannot change. Okay, but the other 4 we can change. Stop your smoking of the free radicals. Okay, if you can't stop your smoking, at least you take ASENTAR, you take something like that to sort of combat the antioxidants. Okay, and the other 3 things would be the high cholesterol, high pressure, and high sugar, diabetes, hyperpressure, and cholesterol. And all these 3 things are what we call degenerative diseases, which are caused by a lot of, what we call free radicals damages in our body. So by taking antioxidants, something like ASENTAR, you're actually tackling all the problems. You're tackling your cholesterol, you're tackling your hyperpressure, you're tackling your diabetes, and you're tackling your smoking. So by all means, if you've had heart attacks, or you've had strokes, or you want to prevent yourselves from getting strokes or heart attacks, yes, by all means, take antioxidants.
Okay. Thank you. Okay, Dr. Chong, just curious, when somebody take ASENTAR and then immediately they have the removing stage, the recovery symptom, remember just how we mentioned, the body will start to remove whatever that's not supposed to be inside. Okay, so when somebody take ASENTAR, after they take any or some good source of antioxidant, when the body starts to remove, they have a lot of what we call healing crisis. Is that true?
How to say? Because when we don't do anything to our bodies, even things are bad for our bodies, we actually sort of reckon it as something normal to us, When something is really helping us, causing good detoxifications or bringing in new chemical reactions, we find it that it is not right. Our body will start feeling something not right. This is what we call the initial reaction syndrome, which is very normal. Just like people with hyperpressure, pressure is high, we ask them to take pressure medicine, but they come back to you after 3 days, they come back to me after 3-5 days, they say, no, Dr. Chong, I cannot, this medicine to bring my pressure down, I get more headache, I get more giddiness and things like that, whatever, But this is the initial reaction when your body is trying to readjust itself, actually, So do not get put off by this sort of symptoms.
I see.
And ASENTAR is very good. Not ASENTAR, I'm talking about antioxidants, You can't really overdose yourself with antioxidants. Antioxidants do not damage your kidneys or, antioxidants do not cause your brain to be damaged or your heart to be, to be failing. Antioxidants are very safe, because the antioxidants come from all these natural things. Astaxanthin is from natural, it's from sea algae, it's from sea, sort of what do you call that, natural products from the sea. So it will not damage your bodies, So if you do experience some initial, symptoms that you do not feel right, yes, you come to your doctors, to ask your doctors about it. Okay, if there's anything right or anything wrong, at least we can just, tell you what to do. But do not get, put off by these things, like minor things like headaches. People might feel a bit nauseated, or they might feel like it's not feeling right initially, but this is not something to worry about.
Okay, Dr. Chong, we have one question from Angela. She's asking, how about recent heart surgery? With high blood pressure condition, can we take ASENTAR?
Yes, as I say, ASENTAR is something natural. It's like a food source. It's a very good food source, There's no connection, that says that ASENTAR causes your pressure to go higher. It causes your, after operation, your wound is going to break down faster or something like that. So I do not see the reason why, somebody after surgery or this sort of like a major whatever, cannot take ASENTAR actually,
Okay.
As I say, ASENTAR is something to make you more healthy. It's not a medicine. One thing about ASENTAR is it's not a medicine. Antioxidants are not medicine. Just like taking vitamin C, it's not a medicine. It doesn't cause really adverse reactions,
Okay. So, we have two questions here. One is, old people on tube feeding, can they take ASENTAR?
In general, tube feeding, I presume the person probably has had a stroke or sort of like bedridden, that sort of things. Okay, and I do not see any reason why the person cannot take ASENTAR. But you probably need to open the capsules and put the the powder into the the feeding, because a tube feeding you need something fluid. You cannot give the tablets. A tube feeding person cannot swallow tablets, so you probably have to open up the because ASENTAR comes in capsules. You probably need to open the capsules and mix the powders into the the feed. Normally it's like milk powder or something like that to feed. I'm sure like that person can take ASENTAR without any problems. As I say, ASENTAR is something like a cell source. It's something that protects the cells. It's not a medicine.
Okay, one more question is, how about people with hyper or hypothyroid? Is there a difference between hyper and hypothyroid? Are they able to take the ASENTAR?
Okay. Thyroid problems actually is quite complicated, like it's a wide range. There are people with hyperthyroid, that means the too much of thyroid hormones being produced by their thyroid gland. And hypothyroid means that the thyroid gland is not producing enough thyroid hormones actually. But when you talk about hyper itself, there's so many reasons, for the hyperthyroid to be there. There are a lot of like Hashimoto's diseases, Graves' diseases actually. A lot of these things are what we call autoimmune diseases. Okay, autoimmune diseases actually what we call your body is producing a lot of antibodies. Okay, your inflammation system in the body is actually being too active. So it's producing a lot of auto-antibodies. That means your body is producing antibodies that fight your own thyroid gland, that causes your thyroid to be having these sort of diseases. Okay, and Astaxanthin, is very good. It's not just an antioxidant. It's anti-inflammatory. That means it reduces inflammation. It reduces what we call overactivity of our immune system. That's why it's very good for psoriasis. It's very good for eczema. Eczema is an inflammatory disease. Like psoriasis is actually like autoimmune. Your body is producing too much of antibodies that attacks your own skin. You get psoriasis actually. So for people with thyroiditis, like Graves' diseases, like Hashimoto's disease that damage the thyroid, causes too much of hyperthyroidism, I don't see why ASENTAR cannot be used. It should be used actually. Okay, but when you do these sort of things, and make sure you're under a doctor's care and follow up. You don't tell the doctor, Dr. Chong said that it's good, so I just continue and take my medicine and and just get ASENTAR for the next 5 years. And you don't do that. You go and see a doctor, you continue to follow up, okay? So if there are changes or if there are improvements, if your diseases, whatever, your doctor might have to reduce the medications, okay? There's no guarantee. As I said earlier on, ASENTAR antioxidants are not medications. They are not there to treat diseases, okay? They are there to help, yourself, your body to improve your conditions, to improve the diseases, to improve the disorders in the body there. Okay, so when you take ASENTAR, you still have to go to your doctor to do regular follow-ups. Okay, to answer that question, I don't see the reason why we can't take it. You should be able to take it.
Okay, thank you, Dr. Chong. Now I have suddenly I have a few more questions here. Okay, let me just answer one first. Which way to take ASENTAR better? Open up the capsule or take it with capsule? Actually, to answer that is very simple. If you open up capsule, for you to have a first taste of it, and that it is not actually a medicine, it's just a food source, and for it will be absorbed better under the tongue. However, the reason why we always advise people to open up so that they can have a first taste. Secondly, is just in case they have a colon situation that they do not know of and they cannot absorb properly. That's why we advise them to open up. But normal consumption with the capsule is fine also, just in case you cannot absorb, so that's why you open up the tongue. And then next one I'm going to ask Dr. Chong will be, if someone has brain 80% function, that means 80% brain function and in coma, can they take ASENTAR or not?
This sounds to me like a very critical condition. Or is a patient in ICU or under tube feeding or anything like that? If the person, because when somebody is in coma or when the brain is not functioning, okay, we really need to know what is the condition that causes, the brain to be,
Yeah, Dr. Chong is stated 80% not function and is in ICU now.
The one you need to talk to the doctor there actually, because I don't know whether feeding the patient is even allowed.
Correct,
because
correct.
ASENTAR cannot be injected. It cannot be injected actually. It has to be fed, to the oral route actually. And this one really you need the permission from the doctor actually.
Okay.
As I say, ASENTAR is not a medicine, but the doctor has a final say. I really cannot comment on this, I cannot really clear answer on this.
Okay. This person asked actually, doctor say only waiting for miracle.
Also, if that's the case, if patients ICU, if the patient, let's say like the patient has been discharged from ICU, is actually waiting for miracle to happen, patient is just relying on your feeding, why not give ASENTAR? When you're feeding the patient with some nutrients, your formulas, whatever like that, why not add the ASENTAR in? I don't see why not.
Okay, one last question because of the time constraint for everybody. This is awesome. The last question here would be, how about people who have kidney disease? Can they take ASENTAR or not?
Okay, I really know what are the causes of the kidney diseases before I can actually make, a real comment on these sort of things actually, As I say again, kidney problems are actually not, ASENTAR is not a medicine, it should not be damaging to any organs, it's supposed to be helping organs actually. So if the person has got kidney diseases, I don't see why ASENTAR cannot be given, okay? But it really depends on what sort of kidney diseases, the person is having. Is it a final, sort of like end-stage renal failure, kidney failure, or is it a chronic renal failure, or is it just a temporary sort of acute renal failure? And the doctor, should be the one, the doctor taking care of the patient should be the one actually answering this question actually.
Okay. So Dr. Chong, I have one final question here. But I realize that the questions are non-stop coming in. Don't worry everybody. What we can do is please continue to type out the questions so that later on I can actually one by one address. But because of the time constraint, here Dr. Chong, we have one question asking, ASENTAR has been very effective for me, especially when it comes to my bruising issues caused by autoimmune blood disorder. My husband, I suppose he is going through the recovery symptoms. We are both on the supplements on the 6th week, but the itching and rash patches for my husband is like flaring up. Should he increase or decrease his intake of ASENTAR actually, Dr. Chong?
So the itching is due to the ASENTAR or the itching is due to the autoimmune disease?
He said that after taking 6 weeks already, it's very good on the bruises, but somehow or rather in the husband, there is itching and rashes actually flare up.
Okay, what is actually the autoimmune disease that the husband was having?
Let me check. Mr. Yo.
No, the itching is due to because ASENTAR might be causing allergy. Anything in the world can cause allergy, even as simple as prawns, cucumbers, anything actually can cause allergy actually. So the itching, I don't know whether it's due to the the autoimmune disease the husband is having. I need to know what is the autoimmune disease before I can comment.
I see. Okay.
If the itching is due to allergy to ASENTAR and it's increasingly getting worse, he or she really go to see the doctor and just assess the itchiness. I think in KL can come to me.
Yeah. Okay. If you're in KL, please go to Dr. Chong's clinic. Will be very good. Oh, the husband is having chronic eczema based on just now. Okay. Basically for this skin condition, eczema, I think we have many cases that actually have a full recovery, but the consumption takes about 6 months. Dr. Chong, these eczema cases, we have quite a lot of cases on this in Singapore. As long as they are taking up to 3 to 6 months time, right, the whole thing will actually subside and then start to recover by itself in that sense. So once I see this one, chronic eczema, more or less, I know what you're talking about already. Okay, good. Okay, Dr.
If it's
Chong.
not bad, you can continue.
Yeah, it's not bad. Okay, one last question from Angela. One last question, everybody. Can ASENTAR help reduce chest pain, nerve pain, or any inflammation pain in the body?
As I said just now, ASENTAR or this Astaxanthin can actually reduce inflammation in the body there, okay? It really depends that actually a lot of things that can cause, like inflammation, nerve pain and things like that actually. It really depends on what is the origin of the disease actually. Is it due to Alzheimer's or is it due to ALS, the 渐冻人, is it really due to peripheral neuropathy by diabetes? If it's really due to neuropathy by diabetes or what we call the degenerative diseases, okay, yes, ASENTAR can definitely help. But as I say again, this is not a medicine. You can't say that I take this thing, I'll be 100% okay. I'll be cured from whatever. You don't really get that. If you're lucky, if the thing causes your condition to be reversed totally, completely, it can. you're very lucky, you know. But astaxanthin is something to help to improve our condition. Something to help to improve our health, you know. But no one can say astaxanthin will actually cure this thing, cure that thing. Actually, nobody can do that.
Okay, thank you, Dr. Chong, because of the time. Dr. Chong, thank you very much for tonight's session. Please allow me to do a summary on this part based on your last point about astaxanthin, or rather ASENTAR is not actually a medicine. Okay, for everybody, just allow me to do a final session here to summarize what Dr. Chong has been saying just now. Remember this, ASENTAR is actually not for you to cure any diseases. ASENTAR is not the medication or a medicine. It is actually a source. It provides the source and the ingredient so that the cells in our body can actually perform miracle again. Now, ASENTAR have two particular source. One is astaxanthin in terms of antioxidant to stabilize the entire body. And the next thing will be the nutrients and the ingredient to help the body to function properly. Now, having said that, just imagine our human body is actually an apple tree. Okay, remember this? This is a summary for everyone to understand. In this apple tree, when you see a bad apple or rotten apple comes out, whatever Western medication that is been using, it is actually trying to do damage control on the rotten apple condition. If it is cancerous, what they will do, they will just cut it out so that it will make sure it does not rotten so fast. However, if the tree continuously to keep coming out different bad apple, what does it mean? If the apples comes out still rotten, is the fruits having the problem or the tree is having the problem? This is a very logical question that we always must ask ourselves, rather than just rely on medication or rather medical or expect a miracle drug to solve the problem. Actually, it does not work that way. In the nature, this is the law of life. If the apple comes out still rotten, it has to be the tree that is having the problem. So if the tree that is having the problem, then we need to ask ourselves, what is happening to the roots? Okay, what is happening to the roots? So over here in our system, roots is where the cells is. As long as we are able to take care, put the right stuff in, the roots will start to take the right ingredient and start to regenerate better cells, better system, better organs, and then we come out, become better apple. Having said this, the key word is always solve the roots so that we all can solve the problems. Never rely on only one thing, because our human body made up of many parts. And because there are so many parts, we cannot just say one thing can solve everything. It does not. ASENTAR only provides the source. The cells in the body will perform the miracle again. Now, having said this, Dr. Chong, do you have any last advice for all our audience that is joining us tonight based on the rotten apple summary?
Okay, Marcus, I agree very much, you know, like what you said just now, okay? We are now in the era of what we call anti-aging, or more specifically, we call preventive medicine, actually, you know. We are not trying to just cure things, okay? We just don't want you to come to me, I've got a cancer, you just cut it out from me. I've got diabetes, my sugar is 12 point something, you know, you just treat my sugar. This is not what we want, actually, you know. We don't want to treat you alone. Yes, of course, if you are sick, we need to treat you, but we want you to not to get sick, okay? And how do we achieve that, actually, you know? As you just said, you know, it starts from the root, you know, and this is really what we call preventive medicine. Just like a tree that you just mentioned, okay? If the tree is producing rotten apples, there's no point just treating the apples. You need to treat the trees. You need to treat what we call the root of the problem, you know? Why is the tree causing, you know, rotten apples? You need to actually make the tree more healthy, and actually, you know, so that the tree can actually produce more apples. And this is very true. And this is what we really want in this era. This is what we call preventive medicine, you know, to stay healthy so that you don't have to rely on medications. And if you do need to rely on medications, okay, maybe you need less medicine, and maybe you need to initiate the medicine at a later stage rather than getting sick, whatever, you know, at the very early stage and needing very high doses of medications. If you can do it, treat yourself, make yourself healthy the natural way, why should you rely on, you know, on artificial medications, you know, in life?
Okay, so with this, thank you, Dr. Chong, for the summary, and we thank you everyone for attending tonight's session. With this, we have come to the end of our date with Dr. Chong on high cholesterol for tonight. With this, I thank you everybody for attending. This will be the end of our today's session. Thank you very much. Thank you everyone. So I am ending this particular session. Bye bye. See you guys, and wish everybody a very Merry Christmas and a very healthy body forever and ever, as long as possible. Okay. Thank you very much. Thank you, everyone.